catheter-associated infections. Could you describe a little bit about what those infections are and what you implemented as a CEO of a hospital that really cares for the sickest of the sick, the most vulnerable? What were some of your initiatives to really have incredible results?
Well, an initiative, the what they call the catheter infections, like your bladder catheter or those lines that go into your arteries and veins, those ones can make you real sick real fast, as you know. That initiative drew from the team. I have an excellent team of clinicians that I work with, from my chief nursing officer to the DQM to the frontline staff, and asking, how do we get ahead of this? How do we reduce these catheter infections? And along with aligning us with what are best practices. And that's where that Institute for Healthcare Improvement came in, is looking at their best practices and adopting much of those alignments and putting them in place with the staff, education around it. So the goal, our original goal, was to cut our line infections by half. We were already really low. So it's, okay, how do we do this? We're already doing real good, or some of the best for LTAC-wise around. And by moving the Institute for Healthcare Improvement best practices in, we are down in probably the 1 to 2% of infections for LTACs across the country. I mean, we are very low. Really, really excited. Our first goal was, let's just, as I said, just reducing it by half. And we far exceeded that goal. And the value to the patient is fewer antibiotics, a shorter length of stay, less risk of mortality or death associated with those, because they're already sick. You throw that on top, odds are they may not make it out of the hospital, which would be devastating.